Hello everyone. Today we're gonna start learning to history of CBT and look into deep and deep look into what CBT can treatment. Okay, first history of CBT. Cognitive behavior therapy took root in behavior therapy. At this time in behavior therapy, the use of targeting and addressing observer behaviors and then tracking the result. An essential part of what would later become cognitive behavior therapy. The therapeutic use of behavior therapy had become much greater by the 1960s, generating more understanding and practical strategy. You've most likely heard about the psychologist Ivan Pavlov. You know him? Most notable for the Pavlov's dog experience. In this experiment, in the form of a bell ring, Pavlov introduced a neutral stimulus and paired it with the potent stimulator of food. Each time the dog was given the food, after a short time of the bell ringing, the dog began to unconsciously tie the two sources of stimuli in its brain together. Eventually, the dog would start drawing and desiring food. Each time the bell rang, even when no food was available. Pavlov's experiment went well past the training dogs, as it enabled scientists to find new ways of affecting the human mind beneficially. Cognitive behavior therapy was still a thing of the future during the time this method was being developed. Respondent conditioning would be a central part of treatment for many individuals with anxiety or anxious need. With the respondent conditioning, a person is introduced to sources of stimuli similar to Pavlov's dog experiment. Such as fear of being, coupled with the absence of unconditional stimuli, which means that they will not get stung. Therapists would therefore they be helping their patients interact with something like bees that usually scare them, but in a safe environment where they would not get stung. This can help people with many different kinds of fears. If a human is scared of dogs, they may communicate with stable and small dogs before their previous conditioned reaction is overcome. Several respondent conditioning studies have found this approach to be effective since it greatly reduces anxiety in those it studied. Over time, behavior therapy continued to develop more producers that would become a part of cognitive behavior therapy later on. In the 1970s, cognitive behavior therapy began to take root in conduct therapy and self-talk therapy. Therapists taught these kinds how to use positive self-talk, coping mechanism, and other specific strategies. A.W. Mayers and W.E. Craighead helped create a shift to incorporate cognitive comprehension and techniques into behavior therapy to create CBT. A large part of this change has been interesting cognitive psychology in providing behavior therapy for adolescents. A. Bandura acts as a springboard to advanced cognitive behavior therapy when he explained the connection between the change in cognition and behavior. This led to more clinicians and scholars starting to understand and concentrate on the knowledge required for behavior therapy in human cognition and information processing, thereby improving CBT. Even cognitive psychology soon impacted self-introduction training, a hallmark of behavior therapy. With the understanding of cognitive psychology, self-instruction training was originally developed to help impulsive children better control their behavior improved. On introduction of self-talk, it was found that self-instruction was more successful. This helped children learn how to better control their behavior by using phrases and statements. Behavior problem solving is another dimension that has been changed with CBT. After all, problem solving while impacting behavior requires processing of information, which is part of cognition. This has been so successful that it has spurred the use of these techniques as means to create positive changes in both therapy behavior and cognition. One of the core beliefs of cognitive behavior therapy is the maladaptive cognitive process make psychological disorders worse and can therefore be reduced by making cognitive process change. This belief, as well as the success, is broad for both adults and children, gave way to an increase in CBT, so that it was widely understood and used. Okay. To CBT, supporters around this time are A. Harper and A. Alice promoted their belief that maladaptive behavior and negative moods result from ill-adapted pattern of thinking. So they concluded that CBT would work on modifying and strengthening patterns of maladaptive, though to improve maladaptive attitude and behaviors. With favorable research on their side, it gradually integrated more techniques and strategy into what was known as cognitive behavioral therapy. Such different techniques provide effective in the diagnosis of different disorders, as not all psychological disorders are the same. It has helped to have a variety of techniques that could be used and customized depending on the specific conditions and needs of the patient. For example, this helped people with a social anxiety disorder and bipolar disorder to both set services customized to their particular needs. Such process producers have provided flexibility in terms of a patient's age as necessary. Therapists have learned how to use these techniques in ways that benefit both adults and children, so that everyone can find help regardless of age. While cognitive behavior therapy took root in both behavior therapy and cognitive psychology, it has become something unique and distinct from the other two methods over time. Today, cognitive behavior treatment in treating people with common psychological disorders and trauma is recognized as one of the most effective forms of therapy. Whether using this treatment with the aid of a trained professional or at home alone, a person is given the resource to improve and achieve a stable mind and happy life again. Look at the 5 steps of emotion intelligence. Look at that. 1. Learn how to effectively gauge problems by handling stress. how to function well in the heat the moment. Realize when overwhelmed, recognizing what tension sounds like as the first step toward reducing stress. How does your body feel when stressed out? Do you have a heavy or sore muscles or stomach? Are there clenched hands? Is it shallow breath? Being mindful of your physical response to stress can help you control discomfort when it arises. Okay? Identify your response to stress. Everybody responds to stress differently. When you start to get angry or irritated under tension, you will better respond to stress relief exercise that will calm you down. When you continue to freeze, you need stress relieving activities which provide both comfort and stimulation. Choose the stress management strategy that resonate for you, and engaging one or more of your senses is the best way to reduce tension quickly. Light, sound, scent, taste, and touch. That's important. If you are a visual person, you can alleviate depression by presenting yourself with uplifting images. Imagine when you listen to the sound and more, you may notice a wind chime, a favorite piece of music, or sound of a water fountain helps to reduce the stress levels easily. Okay? 2. Reduce relationship stress with emotional awareness. That's important. Reduce relationship stress with emotional awareness. Some people are detached from their emotions, especially strong core emotions like AIDS, depression, fear, and happiness. This may be the product of negative experience in childhood that taught you to try shut down your emotions. But even though our emotions may be scared, rejected, or numbed, we cannot remove them. Whether we are mindful of them or not, they are still there. Without emotional awareness, we cannot fully comprehend our own desire and needs or interact with others effectively. Therefore, we face a much higher risk of getting confused in circumstances that tend to be dangerous. What relationship do you have with your emotions? What relationship do you have with your emotions? Can you experience feelings streaming from moment to moment? Experiencing one emotion after another as your perceptions change. Do you feeling go hand in hand with the physical sensations that you feel in areas such as your stomach or chest? Can you exhibit distinct emotions and feelings such as rage, sorrow, terror, and happiness, all of which are visible in subtle facial expressions? Do you experience intense emotions deep enough to catch your and others' attention? Look out for your emotions, what they are affecting your decision making. If any these situations are new, you can shut your emotions off or turn them off. For order to be emotionally healthy and emotionally intelligent, you have to reconcile, embrace, and be confident with your core emotions. Okay. Developing, we looking for the developing emotions awareness. At any time of life, mental sensitivity can be learned. If you haven't learned how to cope with stress, it is important to do that first. When you are able to manage stress, you feel more comfortable reconnecting with the strong or unpleasant emotions and changing the way you experience and respond to feelings. Okay. 3. Improve your nonverbal communication. We're going to learn the steps of the emotional intelligence. 3. Improve your nonverbal communication. Being a good communicator needs more than just verbal skills and stress management capabilities. Sometimes what you're doing is less important than how you are doing it, or the other nonverbal signals you are sending out, the movements you are making, how you're working, how quickly or how loud you're talking, how close you're standing, how much you're making eye contact. To keep others' interest and create communication and confidence, you need to be mindful of the body language and be in charge of it. You also need to be able to read and respond correctly to the nonverbal signals other people are sending you. Okay. The tips for improving nonverbal communication. So you read that stressful nonverbal communication depends on how well we handle the tension, know your own feelings, and appreciate the message you send to the receive when communicating. So you're gonna read, you have to read the tip for improved nonverbal communication. Next, number 4, how to use humor and play to deal with challenge. Humor, music, and play, a natural antidote to the challenge in life. They make the stresses easier and help you keep things in perspective. Thinking pain in ways through encouraging you to see your grievance and disappointment from new perspectives, you will overcome annoyance, hard times, and defeat through the fun and play. On meditation, simple. Using soft language also lets you say things without causing an uproar that could otherwise be difficult to express. Chill and get yourself energized at the same time. Playful contact soothes exhaustion and relax your body, helping you to refresh your energy and do more. Have more innovative look. You liberated yourself from traditional ways of thinking and being as you loosen up, freeing you to get creative and see things in new ways. How to develop playful communication. Try to set quality playtime to aside. The more you smile, play, and chuckle, easier it gets. Choosing fun activities to help you relax up and embrace your playful nature. Try playing with the children, infants, kids, and outgoing people who like playful better. How to resolve the conflict positively. That's important. Okay, last thing. Conflict resolution in positive, constructive ways will enhance faith among people. And confrontation is not viewed as dangerous. It encourages independence, innovation, and relationship stability. When you know how to manage tension, remain emotionally involved and conscious, interact non-verbally, and use fun and play, you will be better equipped to deal with emotionally charged circumstances and recognize and diffuse the problem before they worsen. There are tips for resolving conflict in the trust-building way. Be concentrated in the moment. Be concentrated in the moment. When you don't hang on to the old wounds and the resentments, you will recognize the reality of the current situation and see it as a new opportunity to overcome all the conflicting feelings. Think what to complain for and what not. Choose the point. Arguments, particularly if you want to settle them in a positive way, require time and energy. Think what to complain for and what not. Forgive hurtful action of other individuals and put them in the past. You need to give up on the temptation to threaten or seek revenge to resolve the conflict. Conflicts which cannot be settled finish. It needs two people to carry on with an argument. Even if you still disagree, you can choose to disengage from the dispute. Okay. What CBT can treat and why it works? We're gonna look at that. Cognitive behavior therapy has been used to combat depression and anxiety disorders for decades. But there are many other problems which can also be used to treat. Depression. Depression is a truly devastating condition, otherwise known as the major depressive disorder. Many people can go on without diagnosis for a long time because they do not know that what they feel is not what everyone else feels. They may also be afraid to talk to family, friends, or psychiatrists to share their experience. This is incredibly dangerous because the more depression goes untreated, the worse it can get, and it can lead to suicidal thoughts or attempts. There are some signs which include: please talk to your doctor if you think you may have depression. Okay, like that. There are signs include that feeling of worthlessness, guilt, emptiness or hopelessness, an emotional numb feeling, loss of interest in activities, out-of-body experience, irritability in adolescents and children, thought of death, injury, or self-harm, a desire, feeling fatigue and low energy, a desire to sleep even when not tired, difficulty making decision, poor concentration, insomnia or hypersomnia, weight loss or gain. The prevalence of lifetime depression in America is 17%. With this disorder rarely affecting about 7% of the population. Girls are 2 to 3 times more likely to develop this condition, while men also develop depression. Medicine sometimes lasts efficacious for short-term depression, but medicine is a significant part of a long-term depression treatment. Many patients next mix of both medication and the medication for long-term depression, while people with a short-term depression are most often treated with counseling. Cognitive behavior therapy has proven to be an effective treatment option for people with both short and long-term depression, often in conjunction with the antidepressant. Okay. The patients and therapists will then work together to set goals for the treatment, learn behavior skills, and daily use techniques. When a person uses CBT, especially for depression, the focus of treatment will be on helping the patients engage in more activities that are important to them, but difficult to accomplish because of depression. Learning to interact better with the world and being kind to oneself are other aspects to which the therapist and the patient will focus. People with a depression experience negative thoughts and beliefs about themselves, the world, the future, and others on regular basis. That's why CBT is so powerful when it comes to treating depression. Many of CBT techniques and tools were designed especially to help a person evaluate these negative thoughts and turn them into something truer, more optimistic. It restructures the mindset over time so that the unhappy person no longer feels as pessimistic or tragic. When their mind is controlled, they perceive them less harshly, they will feel less depression symptoms and be able to enjoy life once again. The producer can even be changed for children and the people with an intellectual disability, so that if they are unable to do it alone, caregiver or parents will help them use the method. CBT works with depression because it helps people to rejuvenate themselves and speak less harshly, which are the signs of the condition. Each of these sessions will likely follow set order, which include the patient mood check, bridging the previous and current therapy sessions together, reviewing the homework of the previous week, setting an agenda for the following week, discussing the agenda, homework assignment, and a session summary. The patients can ask any question during this session or discuss any problems that may occur so that the therapist can work them through a solution. Next, anxiety. Anxiety is a feeling of nervousness, fear, or uneasiness that is normal human experience, right? It also exists in a wide range of psychiatric disorders, from common anxiety disorder, panic disorder, and phobia. Each of these conditions is distinct. They both contain anxiety and fear-related depression, and dysfunctions. Anxiety describes a normal response to danger or psychological stress. Normal anxiety is grounded in terror and serves a significant role of a survivor. Anxiety is considered condition when it happens at inappropriate times, happens regularly. Anxiety is so severe and long-lasting that it interferes with the normal activities of an individual. Anxiety occurs at inappropriate times. Anxiety disorders are more common than any other types of mental health disorder. In fact, approximately 50% of adults in the United States. Do you know GAD, SAD, general anxiety disorder, and social anxiety disorder? There are many types of anxiety disorder, such as generalized anxiety disorder, disorder of social anxiety, panic disorder, obsessive compulsive disorder, and more. Attack of anxiety can cause constant stress, panic attacks, and crippling fear, but you don't have to live this way. Treatment is possible, and for those suffering from anxiety disorders, there is a long track record that CBT is the best choice. The most common form of anxiety disorder people experience is generalized anxiety disorder, better known as GAD. GAD, we call GAD. GAD is marked by access and persistent fear and worry. The fear may be about oneself, others, the world, the future, or almost anything else. People frequently think about family, jobs, money, health, and other pressing life issues. Unlike most people, though those with GAD and unable to regularly or handle their own worries and fears, causing it to become a nightmare. Women are twice as likely to develop the GAD as men and realize the anxiety disorder is diagnosed in 3% of the population. This is not cause overwhelming concern, but this constant anxiety can also trigger stomach ache, fatigue, and headache. Many people with mild or moderate GAD or those who are receiving treatment can normally live with society. Okay. Social anxiety resembles the common anxiety disorder, but it has more specific cause. With social anxiety disorder said, a person is particular anxiety to interact with others. There is overwhelming fear that their colleagues will ignore and criticize them. This can result in the person with this sad, acting visibly anxious by stumbling over work, acting awkward, and blushing, which can ever result in others seeing him as weird, boring, or stupid. About 15 million people suffer with a social anxiety disorder, making it the second most prevalent form of anxiety disorder after phobia. During the teenagers, SAD can often grow and continue to affect the person into adulthood. People with this condition may have been excessively shy during childhood, but it is important to note that between basic shyness and social anxiety disorder, there is a big difference. Learning to tolerance uncertainty. CBT helps a person learn to cope with the uncertainty and thus eliminate this source of anxiety and make them more productive in their daily life. Recognize rumination. Rumination is the continuous process of dreaming about the same topic. A person may constantly worry if they will receive a job promotion for a whole week or two. This leads to a decrease in problem-solving capabilities and to increase general concern. Rather than ruminating on a dilemma, it's best to wait and deal with the problem-solving situation when it happens. There are several CBT techniques such as mindfulness and diffusion techniques that are used to help lower the rumination. You will learn to accept whatever thoughts you have, acknowledge it, that they may not be entirely accurate, and then allow them to pass by. Okay, recognize rumination, recognize thought distortions. Thought distortion can take many forms, such as underestimating one's own abilities, predicting the future negatively, personalizing negative experience, black and white judgment, catastrophic circumstance, predicting negatively what others might think, entitlement, and more. A person learns to recognize their distortion with CBT and then replace them with more balanced thought. Next, adopt mindfulness techniques. Adopt mindfulness techniques. CBT also uses awareness, deep breathing, and relaxing for muscles. These techniques help a person reduce their mechanism of avoidance and work instead of to improve their head-on anxiety. Instead of continuing to wade into pool of fear, worry, and ruminance, a person is taught to deal with anxiety directly and lessen it. Next, treat yourself kindly. Treat yourself kindly. It is important to remember that although CBT is often the best treatment option for anxiety disorders, no quick fix is found. While a number of weeks you will see improvement, it will take several months until you see the full benefit that cognitive behavior therapy has to offer. Don't give up after a single day or a week. If you're hoping to see the result of your labor, you need to put constant effort into it. Reducing stress, you can better understand how your mind works when learning about anxiety. Okay. To have a reliable loved one, you will have more support and feel it easy. Reducing stresses like a toxic relationship, unneeded pressure will reduce unnecessary worries, enabling you have the more energy for what's important in your life. You can strengthen and improve your mind by creating a healthy mind by eating well, exercising well, and avoiding drugs. Post-traumatic stress disorder. People often think of this anxiety disorder as just something that military members have been mobilized to enter war zone, but this is not valid. Anyone who has experienced a traumatic event will develop the post-traumatic stress disorder, PTSD. Terrorist attacks, serious accident, natural disaster, sexual assault, violent attacks, and more can all lead to the development PTSD by someone. Most common symptoms and effects include like that. You read that. Inability to remember traumatic event aspect, not included by drugs, alcohol, or head injury. Failed to blame oneself or others. Exaggerated in pessimistic views or perceptions about the environment, others, or oneself. The behavior is aggressive or irritable. Felt detachment from others, preserving shame, guilt, fear, anger, and horror. The behavior is a self-destructive or lackness, hypocrisy, harder to concentrate, easier to stumble. Emotional numbness, and the denial of painful memories. Blah, blah, blah. Okay. Obsessive compulsive disorder. Obsessive compulsive disorder, 3 steps of CBT treatment for the obsessive compulsive disorder include imagine the exposure. Imagine the exposure, real life exposure, ritual prevention. Imagine exposure. Though the imagined exposure person visualized himself psychologically in condition that is normally distressing or the effect of a situation that is fear. They might imagine, for instance, starting a kitchen fire and dealing with the result. Real life exposure. A person will expose himself to a weird situation on an object that triggers anxiety with that step. This could be jump, a messy space, or some other trigger. Ritual prevention. This suggests an individual avoid acting upon ritualistic behavior in this phrase. Addiction. So 3 steps to CBT treatment for the obsessive compulsive disorder. Imagine exposure, ritual prevention, addiction. That's 3. The exposure therapy in CBT. The exposure therapy is a method used in behavior therapy to combat fear and anxiety. Exposure therapy embodies the maximum face your fears, involves the encouraging client to face an object or situation that cause them anxiety over and over again. It can be done in various formats, including imagined exposure, exposure to picture or recollection of the object or circumstance be feared. In people exposure to the object or condition in real life. Interceptive exposure exposure to body sensation, and more recently exposure to object and circumstance and virtual reality. Okay? The most effective therapeutic approach for the treatment anxiety disorder is exposure therapy. It is an essential component of evidence-based cognitive behavior therapy for the phobia, panic disorder, post-traumatic stress disorder, obsessive compulsive disorder, and social anxiety disorder. Exposure therapy success is not expected. However, an exposure response is not standard based on which anxiety disorder is treated. Between 10% and 30% of individuals will not respond to exposure therapy. Some people only follow a course to get the fear back following medication. Recent research into the inhibitory theory of learning shed some light on why that might be the case. In this article, we explore the philosophy underpinning exposure therapy and review some recent research results that may help physicians perform more successful CBT exposure therapy. For PTSD, behavior treatment is intended to help the patients confront and gain control of the anxiety and discomfort that was debilitating incident, and must be handled very cautiously so that the victim is not traumatized. In some situations, trauma experience or flashbacks can be addressed all at once, while for certain people or traumas use relaxation techniques and either dealing with the last stressor or treating the trauma one piece at a time. It's better to work slowly up the subburst trauma. Okay. Next time, we're gonna learn the key principles of CBT. Okay, and a step-by-step approach to overcome anxiety and depression, and or alternative CBT approach. Okay, see you. Bye bye. Thank you.